I did undergraduate at Valparaiso University in Indiana, and then I went to grad school at Southern Illinois in Carbondale. And while I was there, I worked at a variety of places, really. I worked at a university clinic, the College Counseling Center, in like a family practice center at the local hospital, at a juvenile prison, and then also at St. Louis Children's Hospital. So lots of different experiences while I was there. I really liked that it was a 2-year position. I feel like that gives you a lot of time to be able to get comfortable in the position and really have that time to grow in your second year when you finally become really comfortable with what you're doing, and then kind of feel more confident to do things that you might not have done in only a 1-year position. I also really liked the area that the clinic is in. I think it provides fellows with a really wide variety of patients because it's the biggest clinic in a really wide catchment area. So you get an incredible amount of variety in patient populations and presenting problems. I thought that was great too. Certainly one thing that I looked for was how the department felt when I was there for interviews. How did people seem to get along? Was it a nice environment? And I think I definitely found that here. I think that really across the board, people get along really well. They look out for each other. They're happy to help one another, even if it makes more work for them. And I really like that environment. It's not one person out to benefit only themselves and everyone else kind of too bad. I think it's generally a very collegial department, and it's really nice to be in a department like that where they, for the most part, treat you like a colleague rather than, some little student who doesn't really know much of anything. So it's nice to kind of build into that professional role. The faculty here within this department, but also just generally in pediatrics, are really interested in their trainees doing well. I think that they provide a lot of support, even the pediatricians, for us to make sure that we're getting experiences that we want, that we're using the skills that we have. A lot of times when you'll be on, say, the pediatric floor or in the PICU and just chatting with the other doctors up there, they'll want to know, what have you done in the past? What are some of the things that you like to do? Oh, I didn't know that you guys did that, or I didn't know that that's something that you've done before. And then they think of that and are more mindful of that when it comes time, if somebody has a similar presenting problem to something that you've worked with before and they think that they could benefit from our services, they're much more likely to then go ahead and put in a consult because they know it would be helpful. Things that I considered a lot were the setting that I would be working in. So one thing that drew me here as well was that half my time is spent on inpatient consultation, which is what I really like to do. So I get to spend the majority of my time doing that, and then a lesser amount of time in outpatient therapy, which fits my interests well. So that was one thing that I considered a lot. Another thing that I considered was the type of fellowship, whether it was one specific problem set that you're working with, like oncology or diabetes or something of that nature, compared to a more general position. And this is certainly a more general position. So you see a little bit of almost everything. And then if you have specific interests, it's easy to develop those here and to build up more of a practice in those areas. But you're going to see everything here. And then the last thing that I considered a lot was location. So my family's in the Midwest. I move with family members, so it was important that where we moved fit with kind of my family needs as well. On a typical day, I'll spend half my day doing outpatient therapy and the other half doing inpatient consultations. So, for example, today my morning would be made up of up to 4 outpatient visitors who come in for typically problems like toileting, adjusting to medical illness, and also your basic kind of depression, anxiety, ADHD behavioral problems are also kind of included in the mix as well. Then at some point in the day, you have time for your administration work. So doing your dictations, filling out any paperwork that you need to do, that sort of thing. And then the last part of the day is dealing with inpatient consultations. So those are very wide-ranging. A lot of times they're new diagnoses that the person is having a difficult time dealing with. For example, on, like a cancer diagnosis, we get a lot of like Crohn's or other GI problems that are long-lasting, and so that's difficult for people to deal with. Also, we get a lot of chronic headaches and chronic stomach aches that will be consulted on. And then also, if a child has like a suicide attempt or an overdose, we see all of those patients as well to assess for dangerousness while they're here in the hospital. And then if needed, to make any referrals for further inpatient treatment for them. Then if once you see a person, you typically follow them through for the rest of their hospitalization. So I might see somebody today and then follow up with them, you know, tomorrow and the next day until they're discharged. We do consults in the NICU, so primarily working with parents of babies who are in the NICU. And then we also work on the pediatric floor and in the PICU. So our age range could technically be from birth all the way up until 19 over in the hospital. Here in my outpatient practice, I also have a pretty wide range. So my youngest kids are, I think, 3 and 4, and I have several high school seniors that I see in outpatient right now. So it varies quite a bit. The nice thing as well, at least for your outpatient, is there's a lot of flexibility to see the types of patients that you want. And so if you need more experience in a certain area, they'll try and funnel those referrals to you. If you really like a certain age group, they'll try and funnel those referrals to you as well. And so I think that the department does a nice job of making sure that you're not only getting additional training and making sure that you're getting what you need, but also to make sure that you're happy with your balance of patients that you have. One thing that I really like is the freedom that I have to set up my own schedule. So when I first started here, I was told how many hours to allot for outpatients and for you know, administrative time, for research time, scholarly activity, all of that stuff. And then it was up to me to work within only one confine to make my schedule, and that was that Monday, Wednesday, Friday in the afternoon I have to be in the hospital, and Tuesday, Thursday in the morning I have to be in the hospital. But aside from that, I could split apart where I wanted my outpatients, where I wanted to do everything else. And I really liked that, so that I felt like I had some control as I was first starting, that at least I could decide when I wanted to see people and when I wanted to, you know, have my more free time, that I could catch up on things. That way I could suit it to my own preferences and my own work style. So I really liked that. And that's also been really helpful in terms of then balancing the hospital work, because if you have a consult and 2 or 3 people to follow up with, it doesn't always fit just in your hospital time. So it allows me freedom in every day. I've always got at least another hour where if I'm not going to have time to see everyone, I can quick run over, and then that way I'm not having to stay late, you know, to do that. I can just fit it in other parts of my day. I think Marshfield's a really nice community. It's certainly small, and your options are limited in certain areas. You know, there aren't a million restaurants or a million places to go shopping. But I do feel like anything that you really need to do, you can relatively easily. And the nice thing about the small community is that you do kind of get to know people around you much more easily than if it were a larger city. So, you know, you're limited in some respects, but it just seems to be a much friendlier general environment than when I've lived in larger places in the past.